Hello.
Hello.
Your name is?
My name is John Holub. I live in Pahoa, Hawaii. I'm 69 years old. In May 21st, 2014, I fell from a tree and broke my back, 5 vertebrae in my back and 3 in my neck, broke 2 ribs and punctured a lung.
You were helicoptered to which hospital?
I was helicoptered to Queens Hospital in Oahu. I spent 9 days in intensive care there, and then I went to the rehab for a total of 3 weeks in Oahu. They shipped me back home, and that's where I was at. When I got back, the doctors at Queens made me bring 100 sorry, I forgot. When I left Queens, I had to take a prescription of 100 morphine tablets, and the doctor said since I did not want surgery, I would be taking morphine twice a day for the rest of my life for the pain. I do not take drugs. They really cause a lot of harm to my system. Therefore, I tried to get physical therapy and went to a chiropractor. The chiropractor refused to work on me because I had a broken back. The physical therapist worked on me for approximately 3 months and said I was making no more progress, so he said, save your money and go home.
Oh.
Well, I've gone to Kaiser, and I started going there, and they said there's nothing in Western medicine that could fix my back. So I called Dr. Marita Jackson-Hines, and she's been working on my back for 3 weeks, and on the 25th of August this year, I was totally pain-free for the first time in almost 2.5 years.
And what did the Dr. Alik at Hilo Kaiser say, John?
Dr. Alik said Western medicine could not help me. He said he could prescribe pain pills, but that's all he could possibly do.
Now, Mr. Holub, would you please turn around and let's show everyone. Now, this gentleman, when I found him, you can see he still has a little bit of the splaying of the upper thoracic area, but nothing to what he had before. And out of bad habit, he still leans his head slightly to the right, but that's just habit. John, lift your arms up, please. You can see full motor movements. Put your arms down. Can you bend over, sir? Straight, complete straight spine, lean up, and turn around. Okay, you can see that he has from, is it the right rib? Left rib. Okay. Or where you broke it prior?
Oh, left.
He broke his left rib prior to the injury, so that's something I couldn't fix. But everything else is looking relatively sound. His shoulders are level. His chest is level. He had approximately on the 3rd thoracic vertebrae in front sticking out, and I can show documentation on that in following photographs. One of the perks to John having therapy was that we noticed he had a hernia that went undiagnosed because the thoracic vertebrae had prolapsed over the liver, causing an inguinal hernia. When we did some blood work at Hilo, Dr. Alik was very, very kind and cooperating. We noticed that his gallbladder bile count had tripled from notoriously a 1.2 to 2.8 and above. In 7 days, his blood report states that it's back down to 0.3. Now, another perk that we had with John, as you can see, he had a relatively large molluscum, and if you can see this, it's now almost skin level and level with the rest of his scalp, and it is not cancerous. So, John, what type of treatment did we do for you? Traditional medicine and osteopathy and...
Yes, we had acupuncture, we had dietary changes. We had to use, Yeah, in conclusion, we just took dietary supplements and acupuncture, and the rest was the doctor was doing her thing with moving the muscles and bones back where they belong so that I could function again.
So all in all, how do you like your treatment, sir?
Well, it's pretty amazing that I was told that the Western medicine could do nothing, and at one option it was either put steel rods in my back or keep me on morphine for the rest of my life. Neither did I want to do. So being able to go around that is wonderful.
Well, thank you, John. You've been a pleasure to work with and an inspiration for every patient that I have met and have yet to meet. Thank you, sir.
You're welcome.